What does your colon pathology report really mean? Imagine you've just had a colon biopsy or surgery, and now you're waiting to understand what those results really say about your health. A colon pathology report is a detailed document created by a pathologist after examining tissue samples from your colon. Its main goal is to give a clear diagnosis and provide essential details about the tissue, especially to determine if cancer is present. This report guides your healthcare team in planning your treatment and understanding your prognosis. The report starts with basic information about you, such as your age and gender, along with details about the procedure performed, like a biopsy or removal of a polyp. It also notes where in your colon the tissue was taken from. Next, the pathologist describes what the tissue looks like with the naked eye, including its size, color, and any visible abnormalities. This is called the gross description. Under the microscope, the tissue is examined in detail. The microscopic description explains what the cells look like and how they are arranged. If cancer is found, the report specifies the type, with adenocarcinoma being the most common form of colon cancer. The report also assesses how abnormal the cancer cells are, which is called the histologic grade. Well-differentiated tumors look more like normal cells and tend to grow slowly, while poorly differentiated tumors look very abnormal and often grow and spread faster. This grading helps predict how aggressive the cancer might be. Another important part of the report is the tumor stage, which is broken down into 3 parts. The T stage describes how large the tumor is and how deeply it has invaded the layers of your colon wall. The N stage indicates whether the cancer has spread to nearby lymph nodes and how many are involved. The M stage notes if the cancer has spread to distant organs outside the colon. Together, these stages help determine the extent of the disease. The report also looks at the margins, which are the edges of the removed tissue. Clear margins mean no cancer cells are at the edges, suggesting the tumor was completely removed. If cancer cells are present at the edges, it may mean some cancer remains, and further treatment might be needed. Additionally, the report checks for lymphovascular invasion, meaning whether cancer cells have entered blood vessels or lymphatic channels, which can increase the risk of spreading. Some reports include molecular or genetic information, like microsatellite instability, which can influence prognosis and treatment options. Understanding all these details helps your healthcare team decide on the best course of action for your care. Remember, your pathology report is just one piece of the puzzle. It's important to review it with your doctor, who can explain what it means in the context of your overall health. They will consider other factors like imaging results and your medical history to give you a complete picture. Always seek personalized advice from your healthcare provider to understand your diagnosis fully and plan your next steps.